we get Alderman Richard Mutton, the Deputy Mayor of Dubbo?
Thank you, Joe. Minister, may I congratulate you first of all on the initiative of the hospital boards. Great. It was needed, and the general public certainly appreciate that. I want to talk about money and bring it up very, very quickly. In your preliminary budget negotiations for the forthcoming year, what are you looking at in relation to city to regional spending in budgetary terms, in general terms at the present time? Is the budget going to be, because we've got 3.9% of the population out here, 3.9% of your budget, or are we going to see more, not only for this region, but for regions generally in New South Wales?
We might ask Dr. Mary Foley to address it.
Is that coming through? Yeah, good. Thanks for that question. As you may know, we're in the process of moving to a new funding model under the arrangements between the COAG arrangements between federal and state governments, and going hand in hand with moving to a more devolved model. We're also moving to a much more transparent funding system, so that which will enable everyone to be able to see transparently where the dollars go and what they purchase. It's generally summarised as activity-based funding, and the model is much more about actually reimbursing or funding health services for what they do. It is going to apply to inpatient, outpatient, emergency department services, subacute care such as palliative care and rehabilitation, and to public mental health services. There will still be the need to have block grants and things like this for particular service areas, particularly for smaller rural and remote hospital institutions, which just have a standing cost to be there, even though their volumes might be light. We're in the process of negotiation nationally about how that's going to work. It does mean that when each district, now that we've delineated them and have local governance in place, for the first time from 1st of July this year, will have a very different looking budget. We're not going to have a huge disjunction from one year to the next, but the budget will actually be much more transparent as to what it's for. The first thing that will do will then highlight lots of questions. It'll raise questions around efficiency, it'll raise questions around gaps in services, and I would predict then that will lead to a very active process of looking at the resource distribution and whether it's fair, whether it's equal, whether it's buying the right services, and whether we're getting the right outcomes for that investment in people's health. So this is a very significant change, and it will, I would suggest, give our district health board and local leadership more ability to look at the money and to look at how it can best be spent, and also, when we're looking at it from a statewide point of view, looking at the distribution, looking at the gaps. So it'll be a very different way at looking. We'll need to, it'll be about, to some extent, this model is really about the money starting to follow the patient. At the same time, we have to look and make sure that the distribution of services and the distribution of dollars overall is providing a fair, equitable access. And of course, for rural, regional and remote areas, there are particular issues and challenges in doing that. So that's a rather long and technical answer, but it does mean that it will be very transparent, and you will be able to ask very penetrating questions, both at the statewide level and the local level, about how the dollars are being spent, and also it will be very transparent, the comparative dollars. And I think that's going to lead to a very dynamic process in how we look at our health resources.
All right, you've mentioned and I thank you for your answer, but you only briefly touched on the involvement, and this is the crux of all this, the local involvement of boards and how much say they have in attaining money for their budget and how much, when they get money, how much ability they will have in distributing that money. And this is the crux of the whole thing, isn't it?
Oh, it is absolutely. We will have to each year continue to work within the amount of money that is appropriated each year through the state budget process for healthcare. The government has that based on a growth formula, and then that is still will be distributed out to districts of a annual capped amount, but how that is made up, as I say, will be much more transparent. In this model, it'll be also much clearer that if the work is done, that it is being properly funded at an appropriate level. It will also provide a basis on which local districts can make business cases, and when I say business case, a business case can be about investment that brings health improvement and benefit to the community for additional resources. The process will be a two-way process. It'll be a process of locally identifying need and service development and putting that forward, coming in terms of the budget coming through on a statewide basis as to what the available funds are in any one year, the statewide planning issues, a negotiation, and then arriving at an agreed budget and range of services, and within that there will be the opportunity in terms of growth funding as to what services can be invested in. So it'll be a much more dynamic process than what perhaps people have seen or experienced in the past, and as I keep saying, much more transparent, so people can get much more of a handle on it and have, I'm sure, what will be very robust debate about the allocation of resources.
Thank you. I've got a further question. I might leave it for a little while and give another person a go.